myself is Dr. Dharmesh Prajapati, practicing as an intensivist and consulting physician at Ahemdabad. Heart failure is basically a inability of the heart muscle to pump out the enough blood to cope up with the necessity of the body parts. And basically it is common in hypertensive and diabetic patients, and usually in coronary heart disease, and usually it comprises almost 5 to 10% of all these patients. Patients who are having uncontrolled hypertension, diabetes, those who having a valvular heart disease or some congenital heart disease, or those having a coronary ischemic heart disease, they are all at high risk of having a heart failure. And patients particularly who are obese and lack of exercise, these are all lifestyle diseases. Also they having a high risk of developing a heart failure disease. Usually, heart failure is a treatable condition if treated in a very good manner. Particularly those patients, we have to screen out all these high risk patients like diabetes or hypertension and particularly coronary heart disease. They have to go for regular checkup like ECG, echocardiogram to know the ejection fraction and all other investigations regularly. So it can be treatable in very initial stage. And usually we treat with beta blockers, we treat with diuretics and some other medicines. So in initial stage, when there is a damage to the heart muscle is very low, then it can be reversible with anti-ischemic drug, diuretics on beta blockers. But in late stage, when there is a massive damage to the heart muscle, then even restoration surgery like cardiac reconstructive surgery is also now available, and it has a good result in a poorly controlled heart failure patients. As I explained earlier, those who are having a uncontrolled diabetes, those who are having a uncontrolled hypertension, those who are obese, and particularly coronary artery disease, valvular heart disease and congenital heart disease, they are all at risk of heart failure. And particularly those patients with COPD or bronchial asthma which are uncontrolled, they also develop the right-sided heart failure. Heart failure is a very treatable condition, and don't panic and go for regular checkup. Particularly those patients who are at risk of developing heart failure, if they do the regular checkup with their doctors, they can prevent the development of the heart failure. And particularly those patients who already have a heart failure, then depending on the severity, there are lot of modality of the treatments are available, and there are good promising results with that. So it is a treatable condition, and there is no need to be panicked. Particularly normal patients, if patient is controlling his hypertension, is controlling the diabetes, particularly lifestyle modification means reducing the weight and regular exercise, these all are, and low salt intake, these are all our modalities we can go for prevention of the heart failure.